Hello, my name is Serena. When my son Donavynn was 21 months old, he was diagnosed with acute lymphocytic leukemia, or ALL. The next 2.5 years or so were filled with outpatient treatments, lumbar punctures, and frequent hospital stays for fever or infections. But we could see the light at the end of the tunnel. We knew his treatment was only supposed to last 3.5 years. But in September 2008, we went in for his routine lumbar puncture, and we had learned that he had relapsed in his spinal fluid. I think that the relapse was probably worse than the initial diagnosis itself. It meant we were starting over and that his prognosis wasn't as good. And it also meant that he was going to be faced with even harsher treatments than he had ever had before. The last 9 months have been filled with inpatient treatments with such high doses of chemotherapy that frequent monitoring is required, and long stays in the hospital for massive infections as a result of losing his entire immune system. This is just a small piece of our everyday lives. Since his diagnosis, it has bothered me greatly that there is so little awareness out there, and that everyone thinks that the place to go if your child gets cancer is always St. Jude. Don't get me wrong, St. Jude is a wonderful hospital. They've done fantastic things. Without them, we wouldn't have the treatments and the success rates that we currently do have. But so many people feel that that's the only place to go, and they don't realize that their local hospitals and children's hospitals are treating cancer patients every day. I think that the belief that there's only one hospital out there is what's caused people to not realize that we have such a problem. People don't realize that 1 in every 300 children will be diagnosed with cancer by the age of 20. This doesn't mean 1 in every 300 families. This means because most families have more than one child. But this complete lack of awareness has led me to decide to do something myself. I have tried many things, from petitions and emails and just putting our information out there. But maybe I need to share more. So I've decided to start videotaping whatever I can of my son's treatment and our everyday lives, the side effects that he has to endure, and everything, to get it out there. I'm going to put it up on YouTube, and I'm going to eventually compile all the footage onto a DVD and send it to talk show hosts and TV stations, anybody, to get this word out there. Because with awareness comes funding, comes a cure. So I obviously have to discuss legal issues with Children's Mercy. I'm not sure what I can and can't record. I'm not sure if they'll allow me to record his lumbar punctures and things like that. But whatever I cannot record, I will discuss in my videos. And the impact may not be the same, but at least it will be included. Some of these videos may be difficult to watch, and me being his mother will probably be difficult for me to record and share. Most of our family's pain and things that we've had to endure have been private. We keep a journal, a blog of his treatments, but most of what is included is not, everything that he has to deal with. It's our private lives, and as long as he gets through it, we're happy. We don't want to complain. But at this point, I just feel that the only way to open eyes is to get the word out there, for them to see what really these children are enduring every day. And, my son's treatment isn't even as bad as so many other types of childhood cancers out there. But I just think people need to see what being a child and having a child with cancer really means. So as time permits, I will post videos, and as soon as I get enough footage compiled, I will put it all on a DVD and submit it. So stay tuned, I guess. Our children need and deserve the same funding and awareness that the adults are getting. They deserve better, more effective treatments that aren't going to poison their bodies with chemicals and radiation that puts them at a greater risk of cancers in the future. More than anything, they deserve to live life to the fullest and enjoy their childhoods. A lot of the times when adults get cancer, we know why. We did something to our body, we didn't take care of ourselves, and that's the result. But what did these kids do? You know, I they don't know the cause, but I can tell you I took care of myself when I was pregnant. I went to my doctor's appointments. I didn't smoke, I didn't drink, I didn't do anything, and I took care of him after he was born, and we have no idea what caused this. And most cancers for children, they don't know the cause. So, without a cause, how can we prevent it? This is why there's such a need for research. We need to know how to cure it, how to fix it, how to screen for it, and it would really be great if we could even learn how to prevent it so that they don't have to endure these treatments. So I guess that is all for now, and just stay tuned, and I will be posting more when we have the time. And thank you.